to share information with our community in another way, just to get as much information as we possibly can out in all the different ways that we could think of. So I'm going to read a little blurb here, a recommended disclaimer. This event is being held by the COVID-19 Ad Hoc Committee, which is composed of Councilmember Vaterlaus and myself, to focus on various topics relating to COVID-19. Today, we will be focusing on the topic, COVID-19. I think I read that one ever before. Although this is not a meeting subject to the formal meeting requirements of the Brown Act, and thus we are not constrained by the agenda requirements of a normal meeting, we would nonetheless ask that people refrain from raising issues that are not related to the topic at hand. You can send in comments through public comment email, which is covidquestions@pacifica.gov. You can also see it live streaming on Facebook. And then again, there'll be a link that we'll send out where you can watch it later if you weren't able to come with us live today. So good afternoon. Hi, Sue.
Hi, Mary. How are you?
Good. How are you?
I'm great. It's a beautiful day.
Yes, it is. Okay. So Dr. Chan, it's been quite a year, right?
Mm-hmm.
And how have you been? Like, how have you been over this past year?
Thanks for asking.
That's a giant question, but
no, thanks for asking. And I think, like many people in San Mateo County, our lives, our professional lives, and our children's lives have been turned around by shelter in place and our fear of the pandemic. And of course, for me, it's been extremely challenging at work. We've been in this pandemic for more than 12 months now, really 15 months. I think the first part of the pandemic, I was in San Francisco as one of its deputy health officers, and 5 months ago, I came back to San Mateo County as its deputy health officer. So I am, I've seen just so many people work so hard in every sector, care for communities, care for their workers, care for their neighbors, and our public health staff and our healthcare providers have really worked so hard. So we're all exhausted. So we're looking forward to brighter days ahead. And how are you both doing?
I mean, I think I'm doing better now than I have been, which is, I think, the case for everybody, right? Sue, how about you?
I'm happy to have had both of my vaccines.
Mm-hmm.
It makes me a little more comfortable. Of course, I wear a mask, wash my hands, social distance, but I am happy that a lot more people are getting vaccines.
Yeah, I also got my vaccine, so I'm fully vaccinated, and I went to the gym today. And it's clean. It's probably cleaner than it's ever been because everybody's cleaning everything. So anyway.
Good, perfect.
Yeah, that's great. And you know what else I noticed with the county? Like some of our grant monitors had to go to the COVID recovery to do the COVID recovery work instead. And so I'm wondering if that will be switching back at any time soon, because there's only like 1 or 2 people working with our grants now.
Yeah, I don't know. I don't know how we're going to be deactivating various county and city staff. I mean, a lot of it depends upon this next several weeks. We're going to be vaccinating many people, the majority of the people in the next 6 to 8 weeks. So we're going to definitely need the help of community-based organizations and city workers, disaster service workers at that time. And we definitely want to make sure now more than ever that any positive case, we really want to make sure we do case investigation and contact tracing so it doesn't blossom into a little mini outbreak, particularly amongst children who are not vaccinated yet. So yeah, that's a great question. So
That's great.
Can I move, since you brought up vaccines, can you let us know how people can sign up for vaccines and what is the current criteria to get a vaccine? I know things change weekly, so
yeah,
currently.
I think yesterday I was in a community meeting, and the governor made a big announcement while we were at the meeting. I think some of us had an inkling that what was to come up, but as you know, as you heard, starting on April 1st, the expansion in eligibility would be 50 to 64. And on April 15th, it will be basically all adults 16 and up. So they're making that announcement, not that they can't promise all the vaccines are going to come at one time. What's been very difficult is that the demand has far exceeded supply. And when something like that, I mean, many folds over, I would say there's 10 times as much demand as there is supply. So there's a lot of bad feelings, concerns, and inequities happened at that time. But so to answer your question, Councilmember Vaterlaus, when that it's April 1st, April 15th, eligibility expands greatly at that time. Vaccine is going to be much more available. All 3 vaccines are very, very effective. And it's not going to, I think it'll still take a couple months to get through everybody. But we're looking at probably by July 1st, July 4th weekend, things are going to be a lot different. We're going to feel a lot different. Pacifica won't be hot at that time. I think we'll still be able to wear masks until then. So, and I think the ways, yeah.
We're pretty cool during that time period.
Yeah.
So July. So one of the things that you brought up was equity. And are there sites available currently for people who don't have cars, or the outreach to communities that aren't able to get to the large vaccination sites?
Yeah, so I just want to acknowledge to the community members who are listening and all the elected officials who've been trying to make things more accessible. We really recognize that, and all the healthcare providers who your members must be calling and saying, to Kaiser and Sutter, like, when is my vaccine going to be available? Because now the eligibility criteria has expanded to those with chronic disease, those in particular sectors, but they just haven't had enough vaccine. So I'm explaining this, not just for a relief to my colleagues, at Kaiser and Sutter, at UCSF and Stanford and our county agencies. There just hasn't been enough vaccine available. So what we've done, and what happens is, this is a conversation, so it's a long answer because people are on phone, like waiting for a long time to get these. This is complex because the way the vaccine is distributed through our extremely fragmented healthcare system is fragmented, right? It goes from the federal source. Some vaccine goes through like different federal systems, through the VA. Some of it goes through, they have a direct partnership with the national pharmacy chains. And then they give some of the vaccine to some of the large multi-county entities. And then they give some of the vaccine to the state, and the state gives some to the locals. And then the locals give some to the smaller healthcare providers. And then what is little that's left is like the county has, and the county tries to have different strategies to be able to provide vaccinations to those communities who are hardest hit with the highest infection rates, highest death rates, least access in terms of like technology to be able to enroll. Also, those who are living in multi-generational households in small apartments. So that is the equity approach. And the crazy thing is that we don't really know what the vaccine supply is every county until like 1 or 2 weeks before. I think you've seen this a lot in the press. So I'm not in the direct operations of making sure this happens. My colleagues and staff are, but they are working crazy hours doing the craziest things to try to get the vaccines to communities who need it the most. And the vaccine is like never staying around in any place longer than like 5 days, because it's as soon as it comes, we know that's coming on a Monday. It's it gets sent to a particular site so that it gets dispensed Tuesday through Saturday. So, and to answer your question, there's been some sites that have been drive up. There's been some sites that are walk up. There have been approaches for homebound seniors. There's been approaches for people with disabilities. I think a lot of that is going to evolve with on April 15th when we go through Blue Shield, the third-party administrator, and we're going to, everybody's going to utilize My Turn. So for right now, you can still go to the sanmatelhealth.org website to sign up. We recommend that you sign up through your healthcare provider, like the Kaisers or Sutters, PAMF. It's a crazy system, like there's a long list. It's like you could sign up for. And then CVS, and then you could sign up for the San Mateo one, and then definitely sign up for the California My Turn, because that's for your general population who's going to be eligible in the next 3 weeks. Sign up at My Turn, and that's how the scheduling is going to be done. So we apologize on behalf of the whole healthcare system. That's extremely frustrating and difficult.
You're doing a great job, and you can only have the number of vaccines that you get. You can't give out more than you've got. So that's the way it is.
Yeah.
Thank you.
Sure.
And I know some of the young people that I work with are very concerned about being able to get the vaccine because they have older people in their homes. And so they'll be really happy to know that they might have an opportunity to do so. It just makes people feel just more comfortable, It's amazing how quickly it has made people more able to just feel comfortable going anywhere, because we stayed inside for so long.
Yeah, definitely.
Yeah.
And for those young people, if their grandparents, parents, uncles, or aunties, or friends who are living with them have been vaccinated, that vaccine is very protective. So you could just breathe a little bit of a sigh of relief too, because even if you do infect them, the likelihood of that person having a severe illness, hospitalization, or death has dropped dramatically. So, it's much less likely. So we're not saying to do Mardi Gras on Lindamar Beach, but we can kind of be just closer to be able to socially connect, feel a little bit better about outdoor dining, feel a little bit more comfortable if to be careful when you're doing some indoor dining, working out. Those are great things that are really important for our community.
Yeah. I know our businesses were hit pretty hard here, and that was a big topic of conversation for a long time. And it was hard for us as elected officials to try to be able to help them.
Mm-hmm.
Right? And so just having this little space for them to be able to open up a little more is really helpful. Sue, do you want to comment on that at all? Or
I'm really thankful that the restaurants now allow some indoor dining. I think it's going to save some of our restaurants. The gym, I also went to the gym this week. And I see a lot more people out. I walk fairly early in the morning, and a lot more people are out than used to be. It's really nice to see people out and hopefully going to the restaurants, and we really need to help them out. It's really important for our sustainability as a city and people and everyone we care about here. So,
yeah,
thank you.
And I think it's going to be important, and all the restaurant workers have been eligible to be vaccinated just to make sure that the owners of the restaurants are giving time off so that their staff can get vaccinated, because they have been eligible for a while. So, and I think we're at a stage of the pandemic, as long as we keep the rates low, that, if you're careful, you can eat outdoors, you can eat indoors, but just as soon as you develop symptoms, go get a test, and make sure you don't transmit it to many other people. particularly if you're working in a, if you're interacting with people who are medically vulnerable. But I think many things become possible if you're careful and you're really thinking about, okay, my symptoms are going to start developing after 2 days, 2 to 10 days, average of 6 days. And if I start developing any symptoms after I had this indoor dining with like that friend, who's not the most careful person, who interacts, who's a social butterfly, as long as you get that test right away, start as soon as you develop symptoms, I think that's what's going to keep yourself healthy, keep your loved ones healthy, and let ourselves continue to live life and thrive as this pandemic is nearing that end of the tunnel.
And the testing, I was surprised last week that the county manager said about 3,900 people a week are still getting tests. Do we have a main testing site, I believe, at, I'm going to let you answer that. Where is the main testing site? And do you think that will continue to be available?
Yeah, we hope so. Jefferson Union School District has a testing site in its offices up above Saramonte there. And it's open, I think, Tuesday through Saturday. And we have similar sites throughout the county. And we would like to have them available. I think the default has always been to go to your primary care provider, but we realize that there's sometimes delays when you go to your primary care provider. So we think that this has been, I think, in some cases more convenient for people to be able to go to these like community testing sites. So again, it's like if you're feeling some symptoms, go to smhealth.org, schedule a test. The testing sites are generally available, not same day, next day. Make sure you don't infect other people in the household until then. And then go get a test, and until test results come back, make sure you kind of isolate yourself, maybe wear a mask even indoors in your own house, and that will prevent your children and other people who haven't been immunized yet from getting infected. I think these are simple steps, that we don't need to have too many more restrictions anymore. If people understand the basic science concepts, we could take care of each other. We could protect other people at the same time too.
I love that you said we can take care of each other, because that's what we should be doing all along. That's what we're here to do, is to take care of each other. So we're in the orange tier, or will that be, we are right now. And so in your opinion, do you think it's going to move forward rather quickly into the yellow, and how does that work?
Yeah, so we need to continue to have both a decreasing case rates for our county. For our whole county as one factor. And it's going down. It hasn't quite plateaued yet. In some other places, it started to increase, but throughout the state, it's still gradually slowing, coming down. That needs to be low. It's on it. It's continuously decreasing, so that's good. We need to have a case positivity rate that's low too. So of all the people that are getting tested, we have to make sure the percentage of people getting positive is not increasing. So that seems to be okay. And the third factor is that we need to make sure that our neighborhoods with lowest income across the county don't have high rates too. We care both about social equity. We care about our brothers and sisters in our county of all races, that they don't get infected. We care because that's what we care about as humans. But if you don't care about that, it's still important, because if particular parts of the county or different communities have high rates, that's going to spread throughout the county. So that, I think there's ethical, moral, and very practical, individualistic reasons that we have equity and equality in this county. So those are the three main factors. I think it's continuing to look good that we're going to go into a yellow stage. At this point, not that much changes actually for us in San Mateo County. Maybe on some hot beach days, like some of our restaurants might be super at capacity. but I think it's going at the right rate because, I'm still a little bit concerned that there's still some adults who are not over the age of 65, those with chronic medical conditions, haven't been vaccinated yet. So that's the community I care about, maybe the most right now, because we've asked our healthcare providers to prioritize immunizing those people, those with severe medical conditions. So we're hearing that they're getting immunized right now. We're seeing some data, but I think this is the part of, even if you're immunized, if you don't care about yourself getting infected, we definitely don't want to infect those people with chronic conditions. These are our neighbors. These are the parents of children who go to your school. We don't want to infect them if they've had recently that they've had cancer, they have cardiovascular disease. It's not about protecting yourself if you're healthy. It's really about just loving your neighbor, protecting your neighbor, and taking care of each other. Just 2 more months and then I think we could go to Taco Bell and have Taco Bell.
Margaritas.
Yeah.
Yeah, that's one of the challenges in Pacifica, has been the influx of people coming in to go to the beach and use the trails. The trails are packed, so much more than they ever have been. So I think that's one of our concerns, is we're not able to, obviously can't control that. And then the influx of people, obviously they go to all the restaurants and the beaches. And so I think people are a little worried about that, because it's mostly people who are coming from out of town to come in, which is great. I mean, we need the business here, but there's that fine line that you walk on too of being safe. So
Yeah, and I would ask that we just continue to love the neighbor, even if the neighbor is in a different part of San Mateo County, a different part of our Bay Area, that doesn't have the privilege of living at such a beautiful coastline. The likelihood of transmission on a trail or a sidewalk is very, very, very low. We just talked to park leaders today, and just from research, I think there's been maybe no known cases of transmission on trails. So that's just not how the disease. I mean, if you're passing somebody, it really requires like close to 15 minutes in a kind of a close conversation. If it's outdoors or indoors, 15 minutes to really have a decent likelihood of transmission. So I know many parts of the coast, many of the more attractive natural parks in the Bay Area have been flooded with people. So 20 of your Saturdays will become busy. But I think that's just the part of loving your neighbor and just tolerating that time. And don't get stressed out if there's people around, because that's not what's causing infections, is not outsiders coming in. I mean, infections are happening because those of us who've just been exhausted are inviting people indoors without masks. And it's not just people of a particular race that have high infection rates. It's all races when we had that surge from November through January. And it's still the blips of cases that we have are no longer in our essential workers, or no longer from immigrants. They're people who've been, they're all races. So again, I'm saying that because I don't want people to be stressed out. You could be stressed out about traffic, I guess, because it's busy to get from from Fassler down to Lindemar, from Safeway to Safeway, maybe. But yeah, I don't want people to be stressed out about that.
and I love that, the simple information, because people need to hear it, right? We're not sharing that kind of information all the time. So I appreciate you bringing that up and making it simple, because I think we just need to make things simple too.
Right.
Sue, do you have any other questions?
I walk outdoors on the berm, and I am happy to say that almost everybody I pass has a mask on. We all watch the protocol. It's like driving, when you're going south, you stay on the right. When you're going north, you stay on the left. And, everybody manages to do the right thing and stay apart from each other and wear a mask. And I'm really proud of that, because even though I know you just said that you're not likely to get it, but at least people are respecting each other enough to wear the masks.
That's perfect. And that's such a great point, Sue. And it's really just an expression of respect for each other and kindness and caring for each other. And I know there's, people who don't believe in masks and are exhausted. And just to be clear, like, we in public health know the science, and we acknowledge it doesn't make, if you're outdoors and you've been vaccinated, there will be coming a time soon when we will provide some recommendations not to wear, that you don't always have to wear a mask if nobody's near you. We totally get it. And like I said, it's like maybe 2 more months or so. Thank goodness we live in Pacifica, not in hotter parts of the United States. But so we recognize that, and just like the CDC made policy changes after quarantine, that you can visit other people without wearing a mask indoors. There's new guidance for that. So when more of the general public has been vaccinated, those restrictions are going to be more recommendations. But those recommendations are because, like, you might be walking across, now doesn't affect me so much. I think if somebody's not wearing a mask, I'm vaccinated as a physician, but it's, we do know that, somebody who's even an older adult who's been vaccinated, the vaccine is not perfectly effective yet. And that person might still feel a lot of stress. It's been a stressful year for that person with chronic disease. That person might be a partner with somebody with cancer. We just don't know. So that's why we're just kind of asking, I think it's wearing a mask is not to protect yourself, it's to protect others from you infecting that person. And really, as you were saying, Sue, just you're protecting that person's mental health for right now. Just for 2 more months, I think by October, when things get hot in Pacifica, maybe, I don't think we're going to have those same, on hot days, not everybody's going to need to wear masks probably. Again, it's just holding on for a little bit longer for your neighbor, I think.
In your opinion, because there are certain variants, do you think that there may be a time when we need a booster or a third vaccine? Is that possible? And just what you think about that? I know no one knows yet.
Yeah, I think that's a great question. So, they're working on studies for doing a booster. I would think that there would be a booster. The need for the booster might not be that high. The vaccine is pretty incredible. And many vaccines are pretty incredible. So because, small changes in the RNA with slight differences in the protein, most of the cells are still most of the T cells will still be able to recognize those small changes. You maybe won't get some of the, theoretical efficacy of 95%, but you're still probably going to be really able to, be very high in preventing deaths and severe hospitalizations. So there probably will be boosters. And I think related to that, we're in this, there's probably 3 more phases left in my mind. One, we're in this phase of lowish case rates and more people getting vaccinated. Our adults with chronic disease haven't been vaccinated yet. So the second stage will be, okay, our adults, most of the adults with chronic disease have been vaccinated, and just some younger adults who have a lower risk haven't been vaccinated. And it's going to shift to the following phase will be all adults were vaccinated, children haven't been vaccinated. Then, and then case rates are going to be low. And then finally, children will be vaccinated, and there'll be intermittent cases here. So there's a long story to that, but I would say most of that we're kind of out of the tunnel. It's like not bright sunshine. It's like clouds and a little bit foggy in terms of okay, we have to worry about rain or we still need to get tested, but we're very close to at that end of the tunnel. We're at a stage of the tunnel where there's enough light that you could actually do things now. Indoor dining, outdoor dining, schools, we could do those things safely. if you're just careful with getting tested, as soon as you feel something, some drip on you from the tunnel, go get tested to make sure it's not something yucky. So
Oh, that's a beautiful way to end our time together.
And I love the positivity.
Yeah, so positive.
okay.
So thank you so much, Dr. Chan, for coming and spending time with us today. It's really important that you are here. We appreciate you, and we'll see you soon.
Thank you all.
Thank you so much for representing your community. It's great to chat with you. Take care.
Thank you.
Okay, bye-bye.
Bye.